It's a 22-year-old woman, Nalli Gravida, with a current diagnosis of recurrent Hodgkin's lymphoma requiring bone marrow transplantation as early as possible.
So I would like to ask Dr. Bagal on this. In scenarios where we especially have taken this scenario for the basically requirement of the bone marrow transplant. So one is the how much time we have and the prerequisites, especially the radiations and all. So can you mention those points?
Yes, so regarding the risk of infertility, it is very high. It is almost, though there are some regimens where it is low, but you could consider the highest risk of infertility. Now, her further treatment would be in two steps. First is to get her disease under control, so that would be an induction chemotherapy or a salvage regimen.
Yes.
And depending upon her general condition, probably we will have some time for oocyte preservation, in my opinion. And whatever we want to do, we have to do it before the salvage regimen, because salvage regimen has to be followed by a transplant immediately. So definitely she requires the fertility preservation.
Yes, definitely. So I would like to ask Dr. Suvarna on this, our approach from the fertility side.
Yeah, so first of all, counseling most important. Yeah, we have to counsel the patient correctly. As we have very short time, again, starting the stimulation as early as possible. And she has to be appropriately counseled about the quality of oocytes that we may have, and there may be a requirement of donoric, but at least she will be as content that at least a trial has been given, and we can go ahead with the stimulation and oocyte characterization for this
Yes,
lady.
definitely. And here also one point to mention that we need to understand about the ovarian mets and ovarian involvement, because we cannot then have the retransplantation of those tissues, and other, of course, we have discussed other problems for the hematological malignancy. And at least if suppose any other possibility, any other option we cannot give, at least in such a situation we give the GnRH agonist for these patients. If they are not opting for any other options, at least it is advisable to go for the GnRH agonist, which is like a chemical shielding.